Hello guys, this is the beginning of a series that catalogs my experience and the experience of others with government over the years on different initiatives that will have benefited Nigeria and Nigerians. The first episode in this series will talk about my experience in trying to get the Jonathan government to do something about the healthcare sector. Sometime in early 2013, I had put together an international consortium to design, finance, and construct a 1,687-bed hospital facility to be known as the Abuja Medical City. As part of this project, we were to upgrade and equip all the government hospitals in Nigeria also. A similar project was being done by members of this same consortium in Ghana at that time and is now fully completed. The project was to be financed with a US Exim loan, which we were to source for the federal government under Goodluck Jonathan. In February of that year, my team and I presented this project to the then Minister of Health, Professor Onyebuchi Chukwu. The Senate Committee on Health, then headed by Senator Dr. Ifeanyi Okowa, who is currently the governor of Delta State, and the House Committee on Health, then headed by Honorable Untitled Chapter, who is currently the minority leader of the House of Representatives. The duo of Senator Okowa and Honorable Elumelu gave their full support and facilitated the meeting with Professor Chukwu, the then Minister of Health. Please watch the presentation we made to him, and I will tell you the outcome of the presentation at the end of this short video.
A compromise with the people of Nigeria. Areas of a hospital complex. The architectural design reinforces the commitment to be a sustainable, functional, comfortable, and efficient medical facility and center for knowledge. Waiting areas include large windows to bring in natural light and create warm, natural, and pleasant interior spaces. Interior gardens facilitate pedestrian circulation and encourage social interaction. Specialized pediatric care is available at the pediatric hospital, where a team of medical professionals can provide advanced specialty care. An
We had engaged one of the leading architectural firms in the world in the area of hospital designs. IBT, one of the lead proponents, had built hospitals all over the world. We had engineering consultants to make detailed construction drawings for this project. We had engaged Dr. Isioma Koba, who had a practice in Atlanta and is a public healthcare expert, to work on a blueprint to attract our medical personnel in diaspora back home to take up opportunities in this hospital city. We initiated discussions with Johns Hopkins Hospital Management to manage the proposed mega facility. And like I said earlier, financing was to be provided to the federal government of Nigeria. At the end of the presentation, the minister whispered in my ears in Igbo language and said, "Do you have access to the president? That's the only way this can fly." Guys, that was the end of Abuja Medical City. Just imagine that a minister who is the representative of the president in that particular ministry was asking us if we had access to the president he works for. Now, this was even President Jonathan, who, to all intents and purposes, was docile and approachable. His own minister was asking me to use my connections to get to him. What do you think happens now with a president who has clearly told his ministers not to bother seeing him at all, but see his chief of staff? Anyways, after wasting a few $1 million in design and engineering fees, we had to park this project as it was clear that the Nigerian government was only paying lip service to this sector. Please fast forward to the present day and tell me, if this project had been executed then, if we wouldn't be in a better position to even start addressing this pandemic. Now they are busy installing Chinese tents all over the place as isolation centers and claiming they are getting something done. The countries we have seen creating huge isolation centers have thousands of fully equipped and properly functioning hospitals that are now overloaded. So they are creating isolation centers for the overflow. In our case, we go straight to the easy option of installing a makeshift isolation center and shamelessly send videos of these tents around to show we are working. China built a hospital in weeks to address this crisis. Watching Boris Johnson being wheeled out of the ICU in a London hospital and seeing the medical personnel clap for him got me emotional. British doctors treating their prime minister in a British hospital. Our own president was in a British hospital for months, and after he came back, did not see it as an opportunity to declare a state of emergency in our healthcare sector. In the same hospital he was treated, you probably had Nigerians as their top experts in different fields of medicine. The same Nigerian doctors and healthcare professionals who couldn't thrive in their own country. Please, wake up and smell the coffee. You need to build hospitals very fast before we run out of time. The hospitals will endure beyond the crisis and will serve all of us. But if you make a tent your hospitals, just know that chances are that you or a member of your family will at some point need a properly equipped hospital during this crisis. And you or they will likely end up in your makeshift tent. Thank you.